Hello, dear students and esteemed learners. Welcome. Welcome to my course on Sociology of Health. Now we have lecture number 18, and the topic that I have selected for today's lecture is the contribution of Ivan Illich in the domain of medicalization, and I have labeled it as Ivan Illich, Iatrogenesis, and medicalization. And the concepts that I have covered in today's lecture are the concept of medicalization as given by Ivan Illich, then iatrogenetic disease, iatrogenic conditions, and then iatrogenesis, types of iatrogenesis as explained by Illich, which are clinical, social, and cultural, and then medical nemesis, and finally criticism and benefits of the contribution made by Illich. Now, we talked about the process of medicalization and demedicalization and several other conditions which are basically related to the concept of medicalization, like under medicalization, over medicalization, in two of the previous lectures. As we explained there, medicalization is a process of extension of jurisdiction of the medical system. That means when the medical terms are applied for the problems which were earlier not defined as medical, or when some sort of treatment is prescribed, biomedical treatment is prescribed for a problem which were earlier not prescribed, then that kind of process is generally known as medicalization. And then we have also stated that medicalization is a two-way process. So when there is a process of medicalization, then there is also a process of demedicalization. And demedicalization talks about a situation in which the jurisdiction of medical is getting reduced. That means a problem which was being defined as a medical problem is no more getting defined as a medical problem. So it is the reverse of medicalization. These things we have already discussed in the previous classes or lectures, right? And there we also mentioned that there are two very important contributions. One from Ivan Illich and second from Michel Foucault. In this lecture, we are trying to understand the contribution made by Ivan Illich. So let us come to the first slide. The concept of medicalization came to the attention of a wider audience through the polemical writings of Ivan Illich. Now, who was Ivan Illich? Illich was an Austrian Roman Catholic priest, theologian, philosopher, and social critic. Now, Illich is known to most of the students of sociology for his social criticism of the formal institution of school. He wrote a book, De-Schooling Society, in 1971, and there he made an advocacy for de-schooling societies. That means he was a big critic of the formal institutions of school. So we are not talking about that, but I thought that you might be knowing Illich for that contribution. Now, Illich in the contemporary context is talking about very critically the process of medicalization. In the book Limits to Medicine, Medical Nemesis, the Expropriation of Health, he offered a forceful critique of modern medicine, claiming that medical establishment has become a major threat to health. Now you are hearing the right thing. Illich says that medical establishment has become a major threat to health. And he provided a dossier of medicine's adverse effects. So he not only stated that, but simultaneously provided basically documents showing the adverse effects of the medicine, the wrongs and harms it has done. And he used the term iatrogenesis for this particular thing, and the term iatrogenesis is generally translated as doctor-induced conditions or medicine-induced disease. That means Illich is saying that medicine is doing harm to humans, and medicine is creating a kind of disease, and sometimes that can also be related to the doctor induced conditions, and that was referred as iatrogenesis, and that is the very critical view of Ivan Illich on the process of medicalization. We will try to understand these views. Before we talk about Illich's contribution on iatrogenesis, let us talk about two important terms. One is iatrogenic disease. This term is appearing in the dictionary also, and I have taken the meaning of this term, iatrogenic disease, from a dictionary. According to Cockerham and Ritchie, iatrogenic disease generally refer to physician-caused illness and disease, such as the adverse side effects of medications and surgery. That means the term iatrogenic disease itself suggests that there are physician-caused illness and side effects and disease, and those are referred as iatrogenic disease. The term is typically used negatively as a criticism of assumption that modern medicine necessarily represents progress. So, very obvious it is that this term iatrogenic is talking about the negative impact of medicine. That is why it is considered to be an antithesis of the view that medicine is basically representing the progress or the positive things only. That means medicine is also creating harm or also representing the negative views. Iatrogenic injury resulting from physician negligence may constitute medical malpractice. In the same book, I also tried to find meaning of the word malpractice, and that is also basically related to some kind of medical uncertainty, but that is also caused because of the engagement or involvement of some of the medical professionals. So, we can understand the term iatrogenic disease, and Illich has given a broader extension to that very term. Now, there is another term, iatrogenic condition. An iatrogenic condition is a state of ill health or adverse effect caused by medical treatment. Now, again, this is talking about the adverse effect caused by medical treatment. It usually results from a mistake made in diagnosis or treatment. So, it's not just talking about the negative impact of the medicine, but it is talking about a kind of mistake made in the diagnosis or the treatment, and can also be the fault of any member of the healthcare term. So this term is going further in having a negative view about medicine and the practice of medicine. Then there are evidences. Research shows that the risk of iatrogenesis in individuals over the age of 65 is twice as high as that of a younger person. That means with age, the negative impact of medicine is getting enhanced. And iatrogenic complications may be more severe in the elderly, because the elderly people may have a weak immunity. So the negative impact can have more severe result. I have quoted basically these studies and taken these from website, and I have mentioned the address of that website over here along with the details of the paper and the author, right? So anybody interested can go and check those details. However, because of these emerging negative views, a Sentinel report argued that these conditions are not caused because of negligence or misconduct, but because of some kind of system-related problems. So this Sentinel report is somehow bringing into focus the system-related problems and not directly alleging the healthcare practitioner or the medicines. But this debate will continue to be there. We will try to understand the views presented by Ivan Illich. Now we will talk about iatrogenesis as talked about by Illich. Illich, in his book Medical Nemesis, promulgated the idea that societies were becoming increasingly medicalized. We can see that the period of 1960s and 70s, we have already studied that the biomedicine and biomedical approach was becoming very popular. We have studied this in multiple lectures. So, Illich says that societies were becoming increasingly medicalized. Doctors were becoming the new priesthood, and modern medicine were creating over dependence on technical fixes. So there are 2 points made by Illich. One, that the doctors are becoming new priesthood. That means they are becoming more powerful, super powerful. And simultaneously, there is a over dependence on the technical fixes, that means the medical interventions. Illich attributes medicalization to the increasing professionalization and bureaucratization of medical institutions associated with industrialization. That means in this particular statement, Illich is talking about 3 things. One, the increasing industrialization, that we all know that is a fact. Now, because of this industrialization, there is a kind of increase in the professionalization and bureaucratization of the medical institutions. And now, because of the professionalization and bureaucratization of the medical institutions, a situation is emerging in which medicalization is actually happening. For Illich, the expansion of modern medicine has created a dependency on doctors and taken away people's ability to engage in self-care. Now comes the most important point, that the increasing dependence on doctors or the medical professional is actually inversely related with the degree of self-care. So what is happening that even for small health related issues, people are taking medicine. For example, a frequent use of painkillers. Now, when someone is having some kind of pain, maybe headache, maybe body ache. Now, there can be 2 approaches to handle that. One, someone may try to understand why this headache or body ache is occurring and may try to avoid those situations, maybe because of work related situation, maybe because of some mental pressure, maybe some other reasons. So, one can think of avoiding those situations so that there should not be a recurrence of the same problem. On the other hand, there can be another approach that if the body ache or headache is there, then you go for some painkiller without even thinking of the kind of thing which is causing that thing. That means the concern for this self-care is basically not even coming into the picture, and people are feeling very comfortable in taking those pills and then continuing to take those pills because the problem may keep on recurring. Illich, who has so far produced the most radical critique of modern or industrialized medicine, argues that death, pain, and sickness are part of being human. Now, you may remember that Illich is also a theologian. So, he's talking about certain things. He's saying that the death, pain, and sickness are part of being human. All cultures have developed means to help people cope with all 3. That means there are 2 important things. One, that death, pain, and sickness are realities. These are almost omnipresent. Death is omnipresent. And just like that, sickness and pain are also present in all societies. Now, along with that, the cultures do have a mechanism. The cultures do teach people a mechanism through which people can cope these situations. So this coping mechanism is very important. And if people have developed this coping mechanism, then they can address the problems caused because of pain and sickness. So this is something which is related to their natural capacity. And if we look at from this perspective, then health can even be defined as being successful in coping with these realities. That means if there are difficulties, if there is pain, if there is sickness, and if people have learned how to cope with those. So if the coping mechanism is well developed, that means people will will address those problems, and that way health can be defined as being successful in coping with these realities. Modern medicine has unfortunately destroyed these cultural and individual capacities. Now, Illich is saying that modern medicine has destroyed this cultural and individual capacities, launching instead an inhuman attempt to defeat death, pain, and sickness. It has weakened the will of the people to suffer reality. That means there are so many things. First, that sickness and pain is natural, it's human. Now, modern medicine is basically trying to avoid that which is inhuman. And because of this, basically, the capacity to cope is getting adversely affected. Further, people are conditioned to get things rather than to do them. Conditioned to get things done. So, they are no longer in the habit of taking care for themselves, doing things themselves, trying to make improvement in their life themselves. On the other hand, they are becoming more and more dependent on medicine. So this is the process that is explained as iatrogenesis by Ivan Illich. Then Illich talks about different types of iatrogenesis, primarily three types of, and I have highlighted all the three types here: clinical, social, and cultural iatrogenesis. All these correspond to different situations. All are interrelated, but also correspond to different situations. It would be important to understand all the three. I'll try to make you understand. I hope you will understand. Illich argues that damage done by medicine to the health of the individuals and population is very significant, and this is clinical iatrogenesis. Because if some medicine, maybe wrong medicine, maybe some kind of wrong surgery, whatever, if something is done and that has caused a damage to the health, then this is simply clinical iatrogenesis, right? So when people go for certain drug therapies or basically get some kind of prescriptions from the doctors or get hospitalized, and because of these things, if certain things are happening, certain negative things are happening, that is basically damaging their health, then that kind of iatrogenesis could be identified as clinical. So if a medicine is taken and there is a side effect, if it is causing certain kind of allergy, if it is creating some kind of long-term impact which is not identified as of now, but over a period of time we get to know that that was caused because of that. If it is creating some kind of resistance for other similar drugs, right? So all these situations could be identified as clinical iatrogenesis. Now, a second aspect of that iatrogenesis is social iatrogenesis, which means the expansion of medicalization into social life. Means there is a blind belief in medical progress and expertise. So when people have this kind of blind belief, now belief is related to our social practices, right? So the shift is visible from the medical belief to the social belief we are basically entering into, right? Because in the first situation, we talked about some kind of situation which happened because of the clinical things. Now, in the second situation, things are happening because of certain belief system, which is basically operating in the larger society. So there is a blind belief in medical progress and expertise and an institutionalization of medicine as an industry that commodifies and sells health. So many things are mentioned here. I will try to make you understand each of these. So first thing is this, that there is a blind belief in the medical progress and expertise, and this belief is basically operating in the social milieu. And that is why the term social iatrogenesis. But along with that, there are two or three other things happening. One is institutionalization of medicine. So what is happening that medicine is getting institutionalized. So we have been talking about basically the kind of acceptance or institutionalization of medicine in many of the previous lectures, and the way medicine or system of medicine is growing, the way basically it is making some kind of specialization, all those things basically are referring to institutionalization of medicine. So what is stated here is this: an institutionalization of medicine as an industry. So it is not just about institutionalization of medicine, but as an industry. And we all know that an industry basically referring to a kind of system where certain declared objectives are there. And one of the objectives are certainly making profit, right? So institutionalization of medicine as an industry, that is very important. And again, that commodifies and sells health. That means health is becoming a commodity. And all the other important things related with these are also becoming commodities. And so there is a commodification of health. So this is a very severe thing that Illich is talking about. And for this, he is making use of the term social iatrogenesis. Through social iatrogenesis, the responsibility for health has been appropriated from individual by medicine and the medical industry. So it's not just the medicine, but the entire medical industry is coming into picture. And they have taken the responsibility of maintaining health from the individual. That is a very strange situation. People no longer take responsibility for their health problems. Thus, people start ignoring various social, psychological, and other factors, the environmental factors, because now they have started to believe that there is no need of taking care of all those things, because we have medicines and we have the medical practitioners who will take care of our health, irrespective of the things that basically we are getting indulged in. So this is a very typical case of social iatrogenesis. Then comes the third type. The third aspect is that of cultural iatrogenesis. So from clinical to social, and now from social to from social to cultural. Now this cultural iatrogenesis denotes a dependence on medicine to cure and to care for. Now I've highlighted the word cure and care for. There are two important things. Now medicines are not only becoming important for cure, but also for care. Now care is a human component. We have been talking about health care or medical care. Now in these concepts, basically care is considered as a human component, a social component, a cultural component. But in this situation of cultural iatrogenesis, this cultural component of care is getting substituted by, again, medicine or medical practices. Illich argues that cultural iatrogenesis means that people no longer take responsibility for their own health problems and the diagnosis of their symptoms. So not only they are not taking care of their health issues, but also not responding to the kind of symptom that they are witnessing or they are having. People start ignoring healthy and natural lifestyle and develop perception that medicine will take care of them. Now, On the basis of my personal experience, I can talk about one or two situations here. When people get hospitalized, then under certain situations or under certain circumstances, we get to know that there are also practices in which the entire medical team is primarily taking care of the persons, and the family is primarily taking care of the finances only. That the human care, the family care, the cultural responses to the type of relationship that basically we have been learning in the society, those often are missing. So thus these dependence basically, which start at the level of the individual, then that increases to the level of the society and organizations, and then it increases up to the level of the culture. So once this culture of dependence on medical system is developing, then everybody basically learning about that, because culture gets embedded in all of us over a period of time. So this type of understanding will get embedded in the mindset of people, and that is why Illich considered this as a very severe situation. And one very important consequence of this is related to the coping capacity of the humans, because the coping capacity will certainly get weakened. Because as we stated earlier, Illich talks about coping capacity. If the body is basically making an attempt to cope with the pain and the illness, then only basically it is growing. And if we have seized the process of development of that coping capacity, then over a period of time, this is getting weakened. The natural capacity of humans getting lost, the natural life is compromised. And I can give you one very practical example. Very often we identify people who are having some kind of deficiency in vitamin D. Now we all know that vitamin D is very important for our body, the functioning of the body, for developing our immune system. Now what is happening that because of the changed lifestyle, people are not getting enough exposure to sunlight. Now sunlight is the richest source of vitamin D. Now what is happening that instead of getting exposure of sunlight, people prefer to take the pills, the vitamin D pills. And a regular consumption of the pills or the pills for vitamin D will create a bodily situation over a period of time in which the body will not be in a position to absorb that sunlight and convert that or make use of that. That means the physical capacity will also get adversely affected. Although we do not have, as of now, at least I do not have any medical evidence for that, but basically we are seeing these things in terms of our experiences, and I think that Illich is talking about some of those extreme situations. Now finally we come to the concept of medical nemesis. We have been talking about the negative impact of medicine. Now what is happening as a result of that? The result of this dependency is a situation of medical nemesis. Now, I have given the meaning of the word nemesis here. Nemesis generally means a punishment or defeat that somebody deserves and cannot avoid. That means nemesis means if someone has been doing something wrong, then he or she will get the punishment for that. And this is what is stated in the concept of medical nemesis, that if there is an over dependency on the medical system, then the body or the person is bound to get punished for that. The harm will be caused. So the result of this dependency is a situation of medical nemesis where harm caused by medicine is difficult to eliminate, except by recourse to further medical intervention, which in itself results in further harm. That means there will be a kind of vicious circle, that there is a problem, then people are taking certain medicines, and then that medicine is creating a kind of dependency, and just to maintain that kind of dependency, people may need further medications, and this will continue to be there, and that will be very harmful. Furthermore, Illich is of the view that a proportion of a new burden of disease is itself the result of medical interventions in favor of people who are or might be sick of this plethora of therapeutic side effects. So, Illich has made very serious criticism to the process of basically expansion of medical system and a one specific type of system. Although there are certain points which are considered important for understanding the side effects of over medicalization, there are criticism to the arguments presented by Illich. Illich's contribution attracted our attention towards the very important phenomenon of side effects of medicine. However, it did invite certain severe criticism because it focused too much only on the negative aspects of medicine, and it ignored the larger benefits that medicalization has brought in the lives of people at large. Illich has almost ignored the positive benefits of medical system, medicalization, which has certainly contributed in reducing the mortalities, reducing the impact of the pandemics or epidemics, and several other interventions. However, the concept of medicalization, as explained by Illich, has also helped in the expansion of biomedical system because it has improved itself because of that kind of criticism, and that is the benefit of this theory proposed by Ivan Illich. So with this we come to the end slide. Here I have mentioned one thing about this problem and one activity question. Just take a look and try to address these, and these are some of the references and recommended readings. So thank you very much for being with me, and take care. We will meet in the next class.